Understanding the mechanism of rapamycin, benefits, side effects, and long-term use. Rapamycin, known for its ability to inhibit the mTOR, mechanistic target of rapamycin, pathway, has become a pivotal drug in various medical fields, from organ transplantation to cancer therapy, and more recently, as a potential anti-aging intervention. However, its long-term effects, especially concerning glucose metabolism and insulin sensitivity, have sparked debate. Some studies suggest that prolonged rapamycin use may lead to metabolic side effects, but closer examination reveals that these effects might not be as harmful as they initially appear. mTOR, insulin resistance, and rapamycin's role. The mTOR pathway plays a crucial role in regulating cell growth, metabolism, and aging. When overactivated by nutrients and insulin, mTOR, through its downstream effector S6K, ribosomal protein S6 kinase, can inhibit insulin signaling, potentially leading to insulin resistance. Insulin resistance is a hallmark of type 2 diabetes, T2D, and occurs when cells in the body become less responsive to insulin, resulting in elevated blood glucose levels. Rapamycin, by inhibiting mTOR, can mitigate this process and has been shown to improve insulin sensitivity in both cells and animals, including humans, when used acutely. Interestingly, while some studies have reported that chronic treatment with rapamycin may also prevent insulin resistance, others have observed glucose intolerance and insulin resistance in rodent models subjected to long-term rapamycin use. Starvation pseudodiabetes, a possible explanation for rapamycin's metabolic effects. To understand why some studies report insulin resistance after prolonged rapamycin use, it is important to consider a phenomenon known as starvation pseudodiabetes, SPD. This condition has been observed in animals and humans subjected to prolonged fasting or severe caloric restriction. During extended fasting, the body prioritizes glucose availability for the brain by reducing glucose usage in other tissues, leading to temporary insulin resistance and glucose intolerance when refeeding occurs. Glycosuria, the presence of glucose in urine, and hyperglycemia, elevated blood sugar levels, can appear, mimicking symptoms of diabetes. Interestingly, rapamycin can be seen as a partial starvation mimetic, meaning it induces a metabolic state similar to that of prolonged fasting. This might explain why some rodent studies have observed reversible insulin resistance and glucose intolerance with long-term rapamycin use. These metabolic changes, characteristic of SPD, are not harmful and do not lead to the complications typically associated with type 2 diabetes. In fact, SPD is often considered a benign, adaptive response to low energy intake and is reversible once normal eating patterns are restored or the drug is discontinued. The long-term effects of rapamycin, balancing risks and benefits. Despite the concerns raised by some studies, the broader picture of rapamycin's long-term effects is more nuanced. For example, in mice treated with rapamycin, the observed insulin resistance and glucose intolerance did not translate into negative health outcomes. On the contrary, these mice lived longer and were healthier than those on a standard diet. This suggests that the benefits of rapamycin, particularly its ability to extend lifespan and prevent age-related diseases, may outweigh the metabolic side effects observed in some cases. Furthermore, in studies involving healthy elderly humans, chronic treatment with rapamycin or its analog everolimus did not lead to hyperglycemia. In fact, Some studies found a lower risk of hypoglycemia in the group treated with mTOR inhibitors compared to the placebo group. This suggests that, at least in humans, rapamycin may not increase the risk of diabetes when used at appropriate doses. Even in cancer patients, where high doses of rapamycin or everolimus can sometimes cause mild, reversible hypoglycemia, this effect is typically manageable and does not require discontinuation of treatment. Hypoglycemia in these cases is a common side effect of many targeted cancer therapies and is not considered a sign of diabetes. Intermittent dosing and lower doses. Avoiding potential side effects. One potential strategy to minimize the metabolic side effects of long-term rapamycin use is intermittent dosing or the use of lower doses. Several studies suggest that administering rapamycin intermittently can still provide many of the drug's benefits, such as lifespan extension and disease prevention, without causing significant insulin resistance or glucose intolerance. This approach may allow for the sustained use of rapamycin in humans, particularly for anti-aging purposes, without the risk of developing chronic metabolic issues. Rapamycin in transplant patients. Is diabetes a concern? In the context of organ transplantation, rapamycin has been a mainstay in preventing organ rejection. Early concerns arose over whether rapamycin might increase the risk of developing type 2 diabetes in transplant patients. However, multiple studies have demonstrated that rapamycin does not increase the risk of diabetes in these patients, and in some cases, it has even been shown to resolve diabetes caused by other immunosuppressive drugs like cyclosporine or tacrolimus. In one study, no transplant patients treated with rapamycin developed diabetes, whereas 7% of those treated with other immunosuppressants did. Additionally, when patients with diabetes induced by other immunosuppressants were switched to rapamycin, 80% saw their diabetes symptoms resolve. These findings suggest that, rather than exacerbating diabetes risk, rapamycin may offer a safer alternative to other drugs in this patient population. Conclusion: the future of rapamycin in long-term use. Rapamycin's potential as a life-extending drug is well established in animal models, and growing evidence suggests that it could be a game-changer in human health as well. While concerns over metabolic side effects like insulin resistance and glucose intolerance have been raised, these effects are increasingly understood as features of starvation pseudodiabetes, SPD, a reversible and adaptive metabolic state. Far from being harmful, SPD mimics the body's response to fasting and caloric restriction, both of which are known to have health benefits, particularly in terms of preventing age-related diseases. For most people, the long-term benefits of rapamycin, such as lifespan extension, cancer prevention, and improved immunity, are likely to outweigh the risks, especially if the drug is administered intermittently or at lower doses. Moreover, the reversibility of rapamycin-induced SPD and its minimal impact on glucose metabolism in humans suggests that the drug's use can be tailored to avoid unwanted side effects. As research continues, rapamycin holds great promise for the future of health span and longevity, providing a tool not only to slow aging but also to mitigate many of the diseases that come with it. By carefully balancing its use, we can harness its potential while minimizing risks, paving the way for a healthier, longer life.